want to start by telling you a story of a family that we work with at Migrants Organise, and a little 3-year-old girl called Amisha. Amisha lives with her parents, Rija and Basu, and her big sister, Shreya. Rija was training to be an accountant before she became a full-time mum. And Rija and Basu were trying to regularise their immigration status when Amisha was born. And I want to paint a little picture of their lives under a hostile environment immigration system. Basu was one of the students who was wrongly accused of cheating on an English language test by the Home Office. MPs have since described this as a shocking miscarriage of justice in a scandal that destroyed thousands of people's lives. And as a result of it, the family spent thousands and thousands of pounds and many, many years trying to regularise their immigration status, spending nearly 10 years stuck under this hostile environment system. They were not allowed to work. They were not allowed to study, and they also had something called the no recourse to public funds condition, which meant they were not able to access any form of state support. And in July 2020, Amisha was diagnosed with a rare form of liver cancer when she was just 10 months old. She needed a liver transplant and many rounds of chemotherapy. The NHS saved her life. After one of the rounds of chemotherapy, she needed to stay in her local hospital because the health workers knew that it was not safe as an immunosuppressed child for her to be discharged home. It was then that the finance team of the hospital came and found Rija and said, "Do you know that Amisha is going to be charged for her NHS care?" Amisha ended up with a bill of £76,000. The NHS Hospital Trust repeatedly attempted to send debt collectors to the family to chase them for the bill. Even while the family told the hospital that they had no means to pay, the charges impacted her parents' immigration status. The Home Office refused Rija her indefinite leave to remain, her immigration status, because she had this outstanding debt. It was only after they started speaking out that the Home Office finally granted Amisha her British citizenship, and her family had their right to stay in Britain recognised. Now they are campaigning for an end to the NHS charging system, for Amisha's bill to be cancelled in its entirety, and to ensure that no other family has to go through this. But I want to make clear that Amisha's story isn't isolated, and nor is it an accident. It is a result of over a decade and more of a concerted attempt by this government to build a hostile environment immigration system, which is deliberately and intentionally designed to make life so undignified, so unbearable, so unlivable for people who move here. We've seen schools forced to share children's data with the Home Office. Landlords have to check people's immigration status before they rent you a home, and our doctors and nurses being turned into border guards, blurring the line between immigration enforcement and the vital public services that people need to live. It is not an exaggeration to say that the NHS and all of our public services are being turned into this new frontier of border control. Since 2014, they expanded the range of services in the NHS that are chargeable, charging migrants up to 150% of the actual cost of treatment, and passing on debts to the Home Office, and the immigration enforcement then use that information to detain and deport people. And in 2017, in probably the biggest step change in the NHS's history, they introduced upfront charging for non-urgent care. We obviously see the untold harm that this causes, people too afraid to seek healthcare till it's too late, families chased by debt collectors, the erosion of trust between health workers and their patients, and finance teams doing things like scanning through bedboards to find the foreign-sounding names. It erodes the principle of universal free healthcare as a human right and introduces the idea and builds an infrastructure for charging people for their healthcare. And targets migrants and try to tell us that they are to blame for struggling public services. But we know that this is a lie. It is designed to distract from the crisis that this government and successive governments before them have been causing in the NHS through underfunding, blaming health workers and migrants. And so I think what's really important and what's come through so much today is the importance of standing united against all of the forces that seek to divide us, against hostile environment immigration systems and the forces of state racism that we see. The hostile environment attempts to turn everyone whose role it is to care in society into a border guard. Anyone who is now being recruited forcibly and against their principles to being a border guard We must now recruit, instead, to be fighters against racist border controls, for justice, and to stand up for everybody's rights. That this campaign is very much already underway, with many of the amazing comrades and activists and organisers in this very room, under the banner of Patients Not Passports. And the mission of this campaign is to build a broad, inclusive, collective mass campaign that unites us against these forces that seek to divide us. Health workers come together with migrant communities, community groups, anyone who cares about the future of the NHS, and about building a decent, caring society which provides care for everyone, regardless of where you are from, your immigration status, or when you moved here. We are very proud to be allied and organised with the Socialist Health Association, organisations like Keep Our NHS Public, Just Treatment, and where we turn up on picket lines to support striking health workers, because we know that truly this is one struggle, one fight. We know that we can only win together, and that is why we need everyone involved. And I urge you to please join the Patients Not Passports campaign. There are groups organising everywhere, every corner of this country. Stand up against the government's immigration bill and any attempts to separate us from people in our community, because only together will we win. Thank you.